I'm thrilled to be here today to speak about reproductive freedom, abortion, and bodily autonomy for all people everywhere. Reproductive rights are human rights. Today, around the globe, reproductive rights are being dismantled and rolled back. But women leaders, young people, civil society, and governments are fighting back. My name is Monica Kerrigan, and I'm the Interim Managing Director for Family Planning 2030. And I am here with this esteemed panel of badass, courageous women leaders. And woo, let's hear it for them. They are an exceptional panelist. Nelly Munyasia, Executive Director, Reproductive Health Network of Kenya. Marta Royo, Profamilia, Colombia. Dr. Alda Antonio Govo, Director, Family Planning Program, Government of Mozambique. Let's hear it for them. Woo! They are going to be answering a difficult question because it's all about learning. What can we learn from you and your work and commitment to strengthen global solidarity and action in promoting and defending abortion rights? Nelly, tell us about Kenya and what's happening there.
Yeah. Thank you so much, and excited to be here now. Abortion is still one of the very difficult conversations we continue to have in Kenya, and I'm sure across the region and across the globe, just seeing what is happening right from the US. In Kenya, abortion is only allowed when the life or the health of the mother is in danger and can only be provided by a trained healthcare provider. However, as healthcare providers, we've not stopped. We continue to provide services. We note that we cannot work alone. We need to work with other actors in the space. We need to work with an intersectoral movement to ensure that we have people that continue to support the work that we do. We need to be part of an ecosystem that helps to fight for access to safe abortion, including generating evidence that supports in developing of guidelines, national guidelines, and these guidelines help build the capacity of healthcare providers. They help to ensure that we provide quality, comprehensive abortion services. We work together with researchers, we work together with academia to ensure that we have a whole team, a whole ecosystem of champions that continue to fight for access to safe abortion services. There is a collective responsibility of all of us to protect abortion rights. Thank you.
Thank you so much, Nelly. We're going to turn it to Marta to tell us about what's happening in Colombia.
All the way down to Latin America. So since the year 2021, the biggest Profamilia, the biggest sexual and reproductive health provider in Colombia, became the leader of Global Care, a global consortium for the advances of abortion and reproductive care. It reunites more than 30 countries from Asia, Africa, Latin America, the Caribbean, and Europe. And through a very innovative, person-centered approach, we have been able to move across abortion self-care, even in the middle of very adverse contexts. So we have learned so much in such little time. You know, it has been really, really powerful for us. And one of the main things that we have learned is that abortion has everything to do with empowering girls, women, adolescents, but also transgender people. Abortion, if you really want to have a really successful gender equality program, global universal health coverage, or even development and climate change, you have to have abortion as part of those programs. Through Global Care, we have also learned that abortion can be possible in all contexts. Why? Because it can go either from providing really good information to prevent maternal mortality in the case and prevent unsafe abortions, to develop as a very strong sexual and reproductive health provider with the latest technology and also telemedicine. So there are so many different strategies that you can implement in your countries. And I think that it has everything to do with listening to what people need, what they're facing, especially the vulnerable. So for us, our commitment is the following. The A word should not be silent. The A word cannot be a scarlet letter anymore. The A word has everything to do with autonomy, the superpower family planning has. The A word has also everything to do with being accountable to our commitments to the girls, women, and adolescents in our countries. The A word is for abortion care, and we should be saying it aloud and with pride.
Wow, thank you, Marta. Woo! Dr. Alda, and I want to thank you. The government of Mozambique has made a commitment to FP 2030, and very proud of that commitment. They also are very committed to abortion access and rights. So, Dr. Alda, please share more.
Okay, thank you for this opportunity. First, I want to say the integration of family planning into other services, it's an important approach. In Mozambique, it is extremely relevant and in line with efforts being undertaken in the country to increase the contraceptive prevalence rates. This includes expanding family planning service access during post-abortion care. I'm talking about Family Planning 2030 commitment. So, under commitment 4, Mozambique intends to address the cycle of repeated unwanted pregnancies and abortions by working with these challenges. Challenge 1, lack of recognition of the problem unsafe abortions and the subsequent need for contraceptive service. And poor availability of a functional service for certain groups of women. I am talking about adolescents and young people and the sex workers. 3, poor understanding and attention to women's reproductive health needs by providers. And 4, misinformation among providers about modern methods of family planning appropriate for post-abortion women and girls. In 2018, abortion care national guidelines licensed and implemented. Providers of trainers and service implementation roll out at provincial level. In 2019 and 2021, the service implementation roll out at the district level and expansion for all eligible health facilities. Challenge, gender and social norms, being continually addressed to women and girls can freely exercise their autonomy and right to choose and decide regarding their service reproductive health. I want to say what Mozambique needs for support this intervention. Availability of contraceptives in record time. Because so if the woman or girls come for a self-abortion service, it is because she didn't want to get pregnant. It means that we failed her once, so we can't fail again. She must came out with a method to avoid getting pregnant again by accident. Once acceptance ensured and met, we will continue to work to answer. Thank you so much.
Wow, thank you so much. Woo! It is so great. I'm going to ask the panel one more question because they are also human rights defenders. They work every day in their clinics making sure that abortion and contraception is available. And I was wondering, what advice would you have to future leaders getting involved and engaged in abortion rights?
To the future leaders, they should be bold in what they believe in. They should fight for what they believe in. More importantly, they should be able to understand what the law in their country say And if it's not supportive, then they should work towards ensuring that they put in place policies, guidelines that are progressive, because abortion is a fundamental human right. Thank you.
Thank you, Nelly. Marta, what would you say to future leaders?
God, so much, but I will go definitely, that just as family planning, abortion is also an essential part of our rights to choose over our own bodies and life projects. When is this going to stop? This is something that the whole world has to understand. This is our bodies, our choice, our right. So this is my best advice for them.
Thank you. Dr. Alda.
So, the family planning and the abortion service is the important service. It's important to involve the old woman, the young people. When we do the policies, strategies, yeah. So it's the important service. Thank you.
Thank you. And it's great to see a government stand up for abortion as essential healthcare services. So I'm going to thank you all. We are so excited to continue to fight for our rights, both for abortion and contraception and sexual and reproductive health and rights for all people everywhere. So thank you so much.